Doctor, thank you very much for being here this morning. Let's talk about just how stretched your hospital system is right now because of the virus pandemic.
Well, unfortunately, yesterday we set our all-time record. And so we had in the past had at 7 p.m. when we measure this every night to get consistent results, 730 patients. Last night we hit 749 across our 2,300 bed system. And it shows no sign of slowing down, unfortunately. And so we are preparing for continued rises and continued stretching of the men and women who've been working so hard for the last 18 months and who really have done a phenomenal job. And it's quite a trying time because we're still not seeing the kinds of protections put in place in the community and the actions taken to really start to bend this curve back down.
Doctor, what do you think, in your medical opinion, is the reason behind the hospitalizations that you have? What is it that's driving that surge back up to the highest levels that we've seen since early this year?
Well, it's kind of a perfect storm of three things. The first of which, of course, is the Delta variant. The Delta variant is widely more infectious. It spreads very quickly. Couple that with low vaccination rates. And in our community, we're probably 5, 6, 7% below the United States averages. And then couple that with, a time where effectively we had no mitigation activities happening in the community. We've started to see that shift back. We're seeing the R, or the spreading, start to come down. But again, we're still seeing record levels and we don't see an end in sight. So we're going to be dealing and smashing through the previous records, unfortunately.
Can you take us through what is different this time right now with the Delta variant surge? I mean, this feels a little bit like it was last summer to early fall when we saw the surge in the first part of the virus pandemic. Are there any similarities and differences in your mind with regard to what we're seeing now versus what we saw in, say, July to September of last year?
It's very similar. The rate of increase is just astounding. I mean, it's day after day and very, very steep, as opposed to the winter surge, which kind of, built in the foothills and then really started steepening. The other thing we're seeing is that this is all about the unvaccinated. When we did a snapshot across the greater Houston region about 10 days ago, 91% of patients in hospital with COVID were unvaccinated. In my hospital system, where we have a huge transplant program and a lot of very vulnerable patients, it's a little lower than that. So we're about 83% or so are unvaccinated, about 17% are vaccinated. But of course, those 17% who are vaccinated are older, they have weaker immune systems, they have immunosuppression because of transplant or cancer, other things. So they're the very people we should be protecting. The bottom line is, if we had all gotten vaccinated, almost no one would be in the hospitals, because those 83% for the most part wouldn't be there, and they wouldn't be infecting the rest of the individuals as well. And so we know what to do. If we today acted like we did last summer, when we realized, oh my goodness, it is really getting bad, and stop today, we could break this curve in about 10 days. Unfortunately, we still haven't seen those kinds of mitigation activities. And I'm afraid we're in for a significant rise still.
A curve implies that there is an upslope and a downslope as well. We've heard evidence, numbers-wise, if you will, statistics from places like the UK and Israel that appear to see that curve on the downswing right now with the Delta variant. Is that something that will happen here in the U.S.?
Oh, I'm sure it will eventually. This will burn itself out. I just don't know when. When we look at the UK experience, the India experience, we should be peaking sometime in the next week or so, but we're not seeing any inkling of that. And that's just hope. I mean, that's just hope that it looks like theirs. And hope for me is not a strategy. What we need to do is focus on planning for the worst and focus on changing behaviors, focus on getting more people vaccinated. And right now, it's really about masks. It's about distancing. It's about stopping doing many of the things we're doing in large group settings, because those are clearly spreading the virus. And this virus spreads like wildfire among people who are not vaccinated. We just see it explode. And that's exactly what is happening right now.